Now, most of us have heard a lot about heart disease, but few people know about the dangers of venous diseases. Dr. Marlon Schul joins me now in the studio to explain how physicians are bringing more attention to Venous Health Month. Why is it so important? First off, March is actually when we're stressing the importance of vein health. But why is that so important, Marlon?
Well, blood is supposed to flow up toward the heart, but when you get stagnant blood, or if you develop a complication such as DVT, which is in an epidemic proportion, life-threatening complications can occur. Unfortunately, there's a lot of misinformation, and it's important that patients understand their personal risk of DVT so that they can go about preventing that.
And those risks are?
Certainly hospitalization, age. There are clotting disorders that people have that they may not be aware of, and other risks such as being obese, having a sedentary job where they sit or stand for prolonged periods of time, prolonged air travel, and particularly any prolonged immobilization, whether it's in bed for a particularly long period of time after an illness or after immobilization from a major bone surgery.
Do you find a lot of people come and see you after a medical emergency, or is it one of those things where it can be cosmetic, where they don't like the way you can see the varicose veins type thing? More so that way, or is it a health scare?
I see the whole spectrum
Really?
of venous disease. In fact, very little of my business is cosmetic. I see the painful, aching, swollen legs, those that have had complications of superficial phlebitis and or deep vein clots on a fairly regular basis. We also see a number of patients with leg ulcers. Again, with 500,000 patients suffering new DVT every year, and with the life-threatening complication of pulmonary embolus that can actually kill someone, it's an important topic, and it's what we're trying to bring awareness of.
Now, any steps that we can take to protect our veins, or is it one of those things that yearly, monthly, semi-annually come in for a checkup?
If there's a concern, and I think everyone should have an assessment if they have any venous concerns whatsoever, but just to promote good venous health, if you've got a job where you're sitting or standing for most of the day, using something to support the calf pump. I wear compression stockings every day. My compression stockings look like regular men's socks, so there's a lot of options to promote support of your calf pump, which is the peripheral heart, to help minimize that stagnant blood and to help normalize or support normal veins. Walking. Regular walking. If we have sitting jobs or standing jobs, we can have swelling in our lower extremities at the end of the day for just occupational reasons. If we routinely employ some form of walking in our daily lives, we're squeezing our calf pump, we're promoting good venous flow and good venous return back to the heart and lessening that risk of swelling. Outside of compression and walking, those two healthy things, those are the things that we can most easily do to help promote venous health.
It's a pretty easy fix, it seems like, or pretty easy prevention, I should say, with the compression socks and the walking around. Just kind of keep things moving, because we have a tendency to sit around and whether it's at work or at home, get our feet up and not do that.
I think that's very true, and yet I think there's very little awareness about those simple tools that can be done. But add to that the presence of obesity, the risk of developing DVT in the obese person versus yourself, for instance, is about 30% greater. So there is something to being overweight, and as we see, the incidence is expected to continue to rise with our sedentary population and our obese trends in our country. So we're not going to see the risk and the prevalence of DVT lessen anytime soon.
Dr. Marlon Schul, thank you so much for being here. Appreciate it.
Well, thanks for having me.
You hear it could lead to death, and that just should give you the motivation to get to see a doctor and take those steps, quite literally. Appreciate you being here.
Thank you.
Coming up at the bottom of the hour,